Just get started while everyone else trickles in. I want to thank everyone for joining us. My name is Alex. I'm a co-founder of SensIQ Nootropics and Adaptogens. Really excited about what we've put together for everyone today. We have Dr. Barr here. Dr. Barr will introduce himself. He's our Chief Medical Officer. We've had some pretty amazing work what we've done, and he's led the study with the team. This would be our second study that we just completed, and it's really exciting. So I'm going to hand it over to Dr. Barr. Please introduce yourself, and then we could get started.
Thanks a lot, Alex. And thanks everybody for joining us this evening and taking the time out. Obviously Mondays are very busy and it's right around dinner time, so we really appreciate you guys making the time to join us. As Alex said, my name is Dr. Luke Barr. I am a board certified neurologist and I'm very proud to be the Chief Medical Officer here at SensIQ. We've been working on a lot of studies, a lot of data that we're trying to generate to try to continue to grow the field on a scientific basis. And we just finished one up on our sleep formulation, which we'll be talking about a little bit later on. And obviously sleep complaints are a very, very common one that we're all going to be seeing, pretty much every day. I know I see it every day in my practice. I'm sure it's the same for all of you. And the most common sleep disorder that we deal with in North America and in the United States is generalized insomnia. So we'll speak a little bit about that, some of the current treatment options, and then we'll talk about the study that we just completed. So let's dive right in. And if you have any questions, feel free to shout them out, or if you're a little bit bashful, we can wait and we have a specified question section at the end. So let's get going. Let's go to the next slide, please. So what is generalized insomnia? We all have a general idea about what it is. Obviously, when we hear the word insomnia, we're thinking difficulty falling asleep or staying asleep, but it also affects our sleep quality and our sleep duration. And in a moment, we're going to go through the actual DSM criteria. But if you just kind of keep that in your mind that it's going to be a problem falling asleep, staying asleep, then you'll have a good idea of keeping it on your radar. And then obviously during your clinical impression, you may want to, check all the boxes, make sure this is a really strong diagnosis for the patients you may be treating. But just the general idea of difficulty sleeping, falling asleep, going on for a period of time, will keep it on your radar enough that if somebody actually meets the diagnosis, you'll be able to kind of fine tune it and go through the DSM sections bit by bit to make sure that you really nail that diagnosis down. So let's go to the next slide and we'll take a closer look at what those exact criteria are. So here we've got the DSM-5 criteria, and as we talked about, falling asleep, staying asleep. But a tricky one that is often forgotten is waking up earlier than somebody desires to wake up, waking up too early. As far as the duration goes, this is a persistent chronic problem. And to meet the diagnosis, it's got to be going on for 3 months or more. And it's got to occur at least 3 nights per week. So obviously these are people that are really, really struggling with how their sleep cycle, their sleep schedule, their overall sleep health. And clearly that's going to cause a multitude of effects downstream as far as their overall function, whether that's mood, cognition, attention, etc. And you can see in this the fourth bullet point is clinically significant distress or impairment. So that's one of the key takeaways that we've got to keep in mind when we're making any kind of diagnosis is impairment in functional status and significant distress. Another very important part of making the specific diagnosis of chronic insomnia is that the diagnosis shouldn't be better matched by another problem, such as narcolepsy. Or for instance, if somebody is abusing methamphetamine, then they're probably not going to be sleeping. So that would be a substance abuse disorder rather than chronic insomnia. So those are, important factors to keep in mind when making the diagnosis. Oftentimes those are pretty self-evident and we've generally screened for those things, but to really nail the diagnosis, you've got to keep in mind all of these things. Next slide, please. So what are the potential causes? Obviously the causes of generalized insomnia are still being assessed scientifically. The actual kind of foundational causes we don't know. We're learning more and more about neuropeptides, neurohormones, receptor changes, neurotransmitter imbalances, etc. But some of the kind of hallmarks that we can see are that there's a number of different factors that could be psychological, physiological, lifestyle related, environmental, or chemical, whether that's medication or non-prescribed substances. So stress and anxiety are major psychological factors that are going to negatively impact somebody's ability to have a restful sleep. And again, these are going to cause pleomorphic changes. And a lot of times this is a vicious cycle that somebody will get into. So it's going to be important to kind of capture that and try to break it down bit by bit so that we can get that person back onto the right track to restful sleep and thereby improve their mood, their cognition, etc. All right. So again, these are going to cause pleiotropic effects that are going to affect people in lots of different ways. A lot of times when we're thinking about an inability to sleep, whether that's falling asleep or staying asleep or waking up too early, we'll think a lot about stress, lifestyle changes such as too much light or work, etc. But oftentimes something that'll escape our mind is something like chronic pain. If you're in significant back pain or you've got really bad knee or other arthritic pain, that's going to make it difficult for you to sleep because you can't become comfortable. Hip bursitis, very common for people that sleep on their side. That can be a major source of people not being able to fall asleep or waking up too early. So it's very important to keep these other potential causes in mind so that we can focus our treatment and pinpoint the exact issue. Gastrointestinal issues. If people are waking up to go to the bathroom, that's going to disturb their sleep and they're not going to be getting the sleep they need. Something that's not on the slide is genital urinary. Very common, especially in men as we age. Benign prostatic hypertrophy, BPH. People are waking up, men especially, use the restroom multiple times a night. It's going to break up their sleep and they're going to have significant downstream problems from that broken sleep pattern. We talked about environmental things. Light pollution is a big one. Noise pollution is a big one. Sleep hygiene, basic sleep hygiene. These are all critical factors that we've also got to kind of key in and give people guidance so that they're going to have the best chance of getting the best kind of sleep they can. And then obviously we touched on briefly substance use. A lot of people forget caffeine it's a substance, is a well-known nootropic substance, been used for hundreds and hundreds of years to help people focus, help wake us up in the morning. But if you need to have a glass of coffee at 5 o'clock in the afternoon, then you're going to have a lot of struggle falling asleep that night. Next slide, please. So some of the pharmacological treatments, we're obviously not going to go into all of them, and we're not going to go into tremendous depth. That's going to be beyond the scope of this kind of a talk. We're just going to hit some of the highlights and some of the big ones that many of us will see in our daily practice. Probably the most common one, the most common class are benzodiazepines. And for the right person, these are tremendous medications. These medications are miracles, there's no doubt about it. But for many people, there's a lot of risk. The effects might be a little bit too significant. And then there's a tremendous group of people that simply don't want to take those risks and want a natural option. And we're going to talk about some of those natural options a little bit later on. But benzodiazepines, they are GABAergic medications that work on the GABA A receptors. And they can vary depending on which one, to having a quick onset or slightly slower onset, but they are generally pretty fast. Typically, it's not something you want to use long term, although many, many people are on them long term for various reasons. And the problems that this cause are the tolerance, dependence, abuse, and addiction, all of which can be very, very troublesome. And there's been a lot of education about these risks, and people are now trying to get patients off of them, and patients themselves, people who use benzodiazepines, are, if not being directed by their physician, or telling the physician, I need to come off of these medications for whatever reason, whether they're having side effects or they just saw something on TV. It's like, what, I need to be careful with this. The next most common class is probably these, what we call Z drugs. They're non-benzodiazepine hypnotics. The most commonly seen one, at least in my experience, is Ambien or Zolpidem. There's also another one, Zalopralol, I think is what it's called. These also work on the GABA receptors, but at a slightly different point of the receptor. And these also can be miracles for the right person. But again, they've got a lot of the same problems as benzodiazepines. It can be effective, but that effect is, again, a double-edged sword. They can affect your cognition. They can affect your overall ability to sleep in a normal way. Very commonly you hear of these kind of strange waking dreams, these dream states where they're, sleepwalking or even driving. And there's been a lot of things in the media, stories in the media about prominent people who, allegedly have been exposed to these kinds of medications who had, unfortunate outcomes because of that particular possibility with this type of medication. Some of the newer ones that we're seeing are these orexin receptor antagonists. These have much more modest effects. And again, for the right person, the right conditions, these again can be great drugs, especially if we've kind of already broken that cycle and need something that's going to keep somebody stable on a clean sleep cycle. But they can also cause sedation. Orexin it's a neuropeptide that is part of our kind of wakefulness cycle. So when that peptide is, activating its receptor, it's telling our bodies that it's time to be awake and active. And by blocking that receptor, we're not getting that input, and our bodies are able to kind of, switch into sleep mode. So not quite as powerful and potent as the first two that we discussed, the benzodiazepines and the Z drugs, but can be used with good effect over a longer term for somebody that's already kind of gotten into an area where they have broken the really bad cycle of not being able to fall asleep at all. Next slide, please. Melatonin receptor agonists, another option that's we're seeing. Remelligon is fairly common. I see it some regularity in my personal practice. The best thing about these is they don't seem to be habit forming, although I have had people tell me that they do feel like there is some level of addiction or tolerance having developed. Again, these aren't quite as potent and powerful as the benzodiazepines and the Z drugs, but for certain groups of people, they seem to do a pretty good job of helping people kind of get into a regular sleep cycle. The next few on here, we're just going to touch on even more briefly than the others. Sedating antidepressants, they are used. They're not specifically, quote unquote, designed for sleep, but they have been seen to be so sedating that they are used, especially under more extreme circumstances, such as hospitalized patients with really bad delirium, to kind of break that cycle, help somebody get to sleep for the first time, sometimes in a couple of days, and then kind of slowly take them off of it. But again, you can get all kinds of side effects such as cognition. Most commonly, people talk about dry mouth or headache, but the cognitive side effects can also be pretty profound. And you can also see some development of tolerance. And I've seen a few cases where people become addicted to it, and it can be very tricky to get them off of it. Antihistamines, again, can be quite sedating. And one of the things that gets people into trouble is these are available over the counter very frequently. And sometimes you see that they've been used inappropriately. And again, you can get tolerance and addiction. And especially in elderly people, you can get confusion. I've seen that confusion set into people that are also quite young. So it can also be troublesome, although they do help people fall asleep. And then antipsychotics, again, not specifically designed for sleep, but sometimes are used for sleep. I've seen people get into a lot of trouble medically with these because of extrapyramidal side effects or other side effects, causing tremor, cognition issues, etc. Again, so any medication can be used for the right person the right way to help that person, but we always have to be kind of wary of what the potential cost is going to be. And more data is showing us that many people don't even want to take the risk and want something that's natural, but also with very potent efficacy and a minimal side effect profile. And that's something that we're very proud of having here at SensIQ with our sleep formula. And let's go to the next slide, please. We'll get into that in a little bit. As we were talking about a little bit before, SensIQ is a company that really focuses on nootropics and adaptogens. So just a brief overview on what these are. So nootropics are what we call, commonly kind of smart drugs or cognitive enhancers. They support our cognition, our focus, our memory, our creativity. and help us kind of, get through work in a slightly more enjoyable way. It affects our motivation in a very positive way. And there's a number of different kinds of these. As you can see here on the slide, they can be prescription-based and synthetic, or they can be natural. At SensIQ, we're focused on natural components, and that's what's in our formulations. We have some examples here, L-Theanine, which is actually in our sleep formulation, and we'll talk about that a little bit later on. But as we talked about caffeine, a very, very commonly known one for hundreds of years, very widely used and very effective. But there's also modafinil, racetams, bacopa. There's many, many, many out there, and they all have a use. But we're particularly proud of the formulations that we have because we've built formulations around the ones with the best study designs and the highest level of efficacy in those studies. So we'll take a look at the next slide. So adaptogens, you heard me talk about those as well. Adaptogens are amazing group of compounds and plants that most of them have multifaceted effects, and they allow the body to cope with stress in an enhanced physiological way through various mechanisms. And that stress may be physiological, such as improving cellular respiration, or it may be emotional, affecting our overall cognition. So these are very, very powerful and amazing plants. And again, we follow that same principle of finding the ones with the absolute best data behind them in the best doses and putting them together synergistically to make our formulations. We can see highlighted in this particular slide is ashwagandha. And we're going to get into that a little bit more because that's in our sleep formulation. But other commonly known ones are ginseng and basil, rhodiola. These are all fairly well known. We're not going to talk about all of them, but we will highlight ashwagandha a little bit later on. Let's take a look at the next slide, please. Medicinal mushrooms, absolutely, amazing compounds that really haven't been evaluated that much in Western medicine, but have been known to Eastern medicine in some cases for thousands of years. So we're extremely excited to be using them and to be building up the kind of Western science that's backing up some of these incredible compounds. A lot of times they've got both nootropic and adaptogenic compounds kind of combined in them already naturally in a synergistic fashion. And we're very excited to be using them in our formulations. We've got highlighted here reishi mushroom, which is again multifaceted, helps with immune support, calming, sleep, those sorts of things. But you've also got lion's mane, which is mostly considered for its sort of nootropic effects. Cordyceps, we've all seen the horror movies where the cordyceps are kind of taking people over, but that's that's not why we're using it. We're using it because of the improvements in people's cellular respiration, energy, stamina, etc. And there's a number of other ones as well, such as chaga, turkey tail, which have robust antioxidant support. But we're really going to highlight the reishi in just a moment as we continue. Let's go to the next slide, please. So you heard us talk about that we had done a study on the SensIQ Sleep formula. What really drove us to do that before we kind of jump into the study? We had launched this formula right around December, maybe a little bit before December, and it's already become our #1 selling compound. The results that we're hearing from thousands and thousands of people is that it has really changed the way that they sleep. And we put it together in a rational way, and we knew that it was going to have a positive effect, but we got such an overwhelming flood of this positive feedback. We're like, we really have to quantify this. We want to quantify this and see how big of a change it actually is. And that's what led us to design the study. So, our thought process was, how big is this change going to be? And we believe that a combination of nootropics, medicinal mushrooms, and adaptogens will be an effective sleep aid that's very, very positively received by people who struggle with sleep. Again, the most common one in America being generalized insomnia. Let's go to the next slide, please. So our trial product we can see here is SensIQ Sleep, and you can see that there are 5 natural ingredients on it. There's magnesium, ashwagandha, reishi, theanine, and valerian root. And I want to just pause on this for just a minute and really stress the transparency. For instance, if you look at valerian root, if you grab other supplements and you read the bottle, it might just say valerian. But we say exactly what it is. We give you the exact species, the exact standardization, and how much you're getting. And all of these components, all these ingredients, they're vetted just as thoroughly as that. We get third-party testing on every single one of them. We, have everything done in a registered facility. Everything is completely verified and transparent. So you know exactly how much of every one of those compounds is in every single capsule of SensIQ Sleep or any SensIQ product. That way you can actually titrate that formula that you're providing to your patients to exactly what they need, like you could any other kind of medication. By being able to titrate it, you're able to get them exactly where they need to be. And if they need a little bit more as things change, then you can give them a little bit more. You know exactly what the dose is going to be. You know exactly what's in it. If they need a little bit less because something's changed, again, you know exactly what the dose is going to be, exactly what's in it. We make everything here in America. And something that's unique, you may have noticed, is that we're completely melatonin free. And one of the reasons why we wanted to be melatonin free is because many people are taking pretty high amounts of melatonin, thinking more is better. And even a small amount of melatonin, especially if taken later at night, or if it's a slightly different bioavailability, or if somebody has slightly different physiology, the way that they process that melatonin is going to be a little bit different. Many times they'll wake up feeling groggy. So we want to avoid that potential problem. So we don't have melatonin in our sleep formulation, which is something that's very, very unusual in this space. Next slide, please. Here we highlight again some of the different components in this particular formulation. And again, we've got the reishi mushroom, and that particular thing is mostly known for its immunomodulatory effects. But in this particular formulation, we're most interested in the triterpenes. And that's because the triterpenes, they function in the GABA pathway. They're GABAergic drugs. They work in compounds. They work in a slightly different part of the receptor, as far as we can tell, compared to benzodiazepines or other things, but they're still GABAergic. And that gives people sort of that immediate sort of nudge towards sleepiness that many people need when they're suffering from chronic sleep problems. There's also some data suggesting that it reduces sleep latency. So that's also very interesting as well. And again, going towards that synergistic blend that we want for people to have sort of an immediate little nudge in the right direction, but also something that's going to kind of build up over time and give them that prolonged quality sleep over months and months and months, and potentially even years. Ashwagandha, again, very commonly is used for its memory and attention. But again, in this particular case, for this sleep formulation, we're a little bit more interested in the withanolides. And those are compounds that affect the NF-kappa beta pathways, as well as chaperone protein pathways. And those really reduce your stress level, again, over time. So these are cellular mechanisms that are changing different transcription factors, and that's going to give you a long-term change to help somebody change their physiological response to stress and put them ideally in a healthier place than they were 3-4 months ago, 1 month ago, whatever it happens to be. Theanine, another one of the compounds in this formulation, excellent for relaxation, stress relief. One of the things that was very interesting to us when we were helping to design this formulation is the data that suggests that it changes our brain waves. It seems to allow a higher level of alpha waves. So alpha waves are the waves of wakeful resting. So alpha waves are kind of a necessary transition into a healthy sleep architecture. And when we talk about sleep architecture, we're talking about the actual changes in the electrical function, the brain waves themselves in the brain. So by increasing that alpha wave, it seems like that's an important component in helping people transition into a healthier sleep pattern. Magnesium, again, very important, relaxes muscles, reduces stress, and also does a number of other things that are kind of critical in helping people fall asleep. There's a lot of data indicating that it somehow alters or otherwise modulates our neurochemical processes, which seem to help people get into sleep a lot healthier, a lot better, and overall improved quality of sleep. Still a lot of research going on and pretty tricky to study for a number of reasons. Magnesium is so important to the body for a host of different things. And last but not least is valerian root. So many people know valerian root as kind of nature's Valium. Again, this is something that binds a GABA A receptors, I believe. And again, at a slightly different part of the receptor than your Z drugs or your benzodiazepines. And this is again giving people that kind of quick nudge towards a restful sleep. That's very important to kind of help people get to sleep, while the other things take a little bit longer to sort of, do their thing in the body and help them stay asleep over months and months and get that overall improvement in their sleep quality. One of the interesting things about valerian is that a lot of data is now showing that it has some modulatory effect on serotonin receptors as well. So you're getting a very interesting interplay in the neurochemistry that seems to help people relax and fall asleep. Next slide, please. So here we've got some of the highlights of how we actually designed this study. So this study was open label and for everybody. So everybody knew what they were taking, and we wanted to recruit about 40 people. So 40 people actually participated in our screening process, and 38 of them successfully completed that. And once those the screening process was complete, people were given a promise self-assessment for sleep, specifically short form 8A, to assess their sleep quality at the beginning. And then we did it again after 7 days of being on the SensIQ Sleep formula. Because of the quality controls that we have in place, again, we're able to actually titrate this formulation. So we did weight-based dosing depending on how much somebody weighed. If they were 150 pounds or less, they got 2 capsules. 150 pounds and over, I think it's technically 151 per protocol, they got 3 capsules. And that seemed to be the ideal effective doses for this study. They took it for 7 days, and then they did that promise of self-assessment a second time. And they also did something called a patient global impression of change, which gives us kind of their overall feel of how well this particular thing that you're testing, in our case, SensIQ Sleep, for them. So, a directional study, but giving us some really good data to push the envelope with additional studies down the road if we desire. And we do have some things brewing that we're all very excited about. So let's take a look at the next slide and see some of our results. So this is something that just is so powerful. This really, really struck me. We all thought that, we've got a great product that really helps people. We get so much positive feedback. But the difference that this slide highlights was just a wow movement for everybody on the team. If you look at the before and after, you're seeing that most people had pretty lousy sleep. Okay, very poor or quite poor before. And then after being on this SensIQ Sleep for a week, they're good to very good. This is a life-changing result that simply blew us away. We did not expect the difference to be this big, and it's something we're extremely proud of. Because going from I'm hardly sleeping at all, my sleep is terrible, to wow, I feel refreshed, is a huge difference for anybody who's ever, worked long, hard hours, for instance, being on call for whatever reason, not sleeping for, a week or two, and then finally being able to close your eyes and get that restful, deep sleep. You wake up feeling like a completely new person. So this was really, really powerful and really kind of just wowed everybody. Let's take a look at the next slide, please. So here we have a breakdown per question from the short form 8A. And again, you can see very, very significant results. If you look at just the top line, satisfied with sleep, you're seeing that most people were not satisfied at all. You know, 1 is not at all, 2 is not much, and then 4 and 5 are very much. So people are going from not satisfied at all to somewhat satisfied or quite satisfied, which again is a very powerful result, especially in the context of when you look at the negative parameters of sleep, where people are struggling to fall asleep, worrying about being able to sleep, trying hard to sleep, sleeping in a way that's restless. You know, these are all significant improvements in the negative aspects of sleep, which are significantly reduced. And then going back to what we talked about in the previous slide, with being refreshing. This last bar, my sleep was refreshing. Again, a significant change from, you know, not really refreshing to quite refreshing, or even in some cases people were reporting very refreshing. So truly life-changing alterations in someone's sleep pattern, sleep behavior, that is really giving people a chance to kind of renew their life, live their best life, and feel positive throughout the day because they're finally waking up and feeling like they're ready to go out and face the challenges of the world. Let's take a look at the next slide. This was something that also kind of blew us away. Almost 75% of people preferred the synergistic blend that we offer in SensIQ Sleep compared to other sleep aids that they had used in the past. And when you're talking about a single question that kind of highlights how powerful the formulation is and how significant the changes people are feeling when they take it, I think this is the one, because you're talking about a change from, you know, I'm not really sleeping very well to I'm sleeping finally for the first time in sometimes years in a way that's actually restful. And the fact that so many people had tried so many different things and really didn't achieve that restful sleep that made them feel refreshed and confident when they woke up the next day. Now with SensIQ R, it is truly astonishing and really, really impressive, and something we're so proud to be a part of. Next question, the next slide, excuse me. And this is something that we take tremendous pride in. 0 adverse effects. We had no withdrawals from the study at all. People didn't have any significant problems. Some people said that they had vivid dreams that were actually enjoyable rather than some of the very negative vivid dreaming you can have with something like zolpidem or some of these other compounds that are pharmaceutical. So obviously there's something going on, you know, in the neurochemistry that's changing the impact of the dream from a very negative impact to a positive impact. And that's something that was very, very surprising to me, and something that we're extremely proud of, that we've got such tremendous efficacy with such a great safety profile and such a minimal side effect profile. Next slide. That's pretty much all we've got as far as the studies go. This is the SensIQ family. We've got formulations that are specifically designed for a number of different complaints. We're really focused on longevity and brain health, and that's kind of our niche, and that's why we're pushing so much into the, you know, generating studies, reviewing data, etc. And as you know, as time goes on, we're living longer lives, but we also want to be living full lives, healthy lives, and energetic lives. And now that we're able to really control all the different components, as far as the production goes, with, you know, traceability, transparency, third-party testing, and developing super tight quality control so people can actually titrate these things. And we're on the one hand, and then on the other hand, continuing to explore the scientific side with compounds like reishi mushroom or valerian root, which really hadn't been studied robustly up until maybe even, you know, maybe on the early end, 30 years ago, and then kind of a little bit more 20 years ago. But now in the past, you know, 5 years, really developing robust data behind these and actually focusing down to the mechanisms of how they work, identifying receptors, etc. It's an extremely exciting time for this, and I think that our best years are ahead for all of us, and we're just going to see an absolute explosion in the quality of life and in these particular kinds of things where you've got extremely high potency, high efficacy, natural supplementation that's combining a lot of different things that have been used throughout history in a way that's very, very synergistic and maximizes the benefits. So extremely exciting stuff. That's all I have. I'm looking forward to any questions you all may have. I think.
Yeah, absolutely. Well, thank you, Luke. Truly amazing, and really proud to have you lead the team, especially from the science board, medical advisory board. Really amazing. I mean, some accomplishments in the study. I do want to add that since we've had so much success with this, and we were asked to present at a conference a few weeks ago, we are actually working on putting together a secondary study, which would be a double-blinded placebo. And so that is something that's going to be in the works over the next few months, and hopefully we'll have the data by December. So it's going to be super exciting, and hopefully we'll see a lot more insights as to the implications and the benefits of the effects of SensIQ Sleep. As for the questions, just please write them in the chat, and we'll go over them one by one.
Chris Greenman asked, so there is no concern or issues with long-term use of sleep, no time limit to be on it? That's an excellent question. Based on the data that we have, looking both at our own internal data as well as the data from each individual ingredient, that doesn't seem to be the case. Of course, the longer somebody's on something, something may creep up over time, but these are all natural products that have been used long-term for many, 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 many decades. And I haven't seen any data that suggests that there is a problem with changes in neurochemistry, changes in brain waves, addiction, etc. So I haven't seen anything like that. Again, obviously, we've always got to be very, very cognizant that everybody's different and anything can happen. And that's one of the reasons that we are exclusively through practitioners, because you're actually engaging with those patients on a regular basis, face to face. And if concerns crop up, then obviously we want to know. But more importantly, you're going to know about it, and then you'll be able to modulate things as appropriate. But short answer, I haven't seen anything like that. I think I saw something else pop up, and I hope that answers your question. And if you have another one, just go ahead and put it out there. Okay, a similar question from Viviana Sepulveda. When it comes to length of treatment, for how long is it safe to take them? Again, very similar to the one that we just discussed. It doesn't seem like there's any significant time constraints on it. We haven't seen any data long-term about that. But again, obviously anything can happen, and it's something that we always have to be cognizant of. But short answer, I haven't seen anything like that, and it's not something that's a top of mind concern for me.
I think there's one from Will Bunnell. Do you see it?
Oh yes, okay, I see one. Oh, that one popped up kind of at the top, but I somehow missed it. What was the most inciting insight you took away from this study? That's an excellent question. As I kind of, I kind of addressed this. So I think for me, the most surprising thing was how big of a difference it made. For so many people, it seems like it's actually a life-changing product where they're finally, after years of trying different things, being able to get quality sleep for the first time in a long time. And although I had pretty good idea that we were going to have a certain level of efficacy and people were going to respond positively towards it, I did not think that the reports would be quite that significant and quite that impressive. So that kind of surprised me about how big of a life change it was for them. I hope that answers your question. Then I see one from Joni Heinisch. Are you completing any studies on TBIs for brain health? That's an excellent question. It's something we are looking at, and stay tuned. Other questions?
Seems like one just came in.
Okay.
From Teresa.
Any dosage recommendation outside what's in the sleep label, and what about its use? Excellent question. Again, because of the quality controls that we have in place and the transparency of all the compounds in the formula, you can follow the basic kind of weight-based guidelines on there, and then titrate that with ongoing discussions in your clinics. We are in the process of putting together some guidance for clinicians who may be not as experienced in utilizing these kinds of things, or just want some kind of baseline to start at. And we are in the process of putting this together and getting them out to people.
Mhm. Yep. I see Dr. Teresa followed up. She's specifically asking with teens, with the question before. So any recommendations
Teens.
outside what's on the sleep label. So
I don't see anything about teens in there.
Oh, no, she just followed up. She followed up.
Okay, with teens.
Yeah.
Yeah. Okay. So there's a couple others in the middle there. Specifically with teens, again, we can go back to the weight-based things. Generally, anybody younger, in my experience, I start a little bit lighter. But again, that's something that everybody's going to have to kind of, feel out in discussion with their patients, because every patient's unique. But generally, somebody younger, smaller, you can probably reduce the dosage a little bit and start with a lower titration point and go up gradually from there.
Yep. And again, to the protocol of the study, I'll just jump in with that, is that for patients that were under 150 started at 2 capsules, and if they were 151 or greater, they started with 3 capsules. So I think it's a good titration point. You could always reduce it from there and always increase it. I see there's just one more additional question from Viana, and says, since there are many formulations from SensIQ, is there any guidance of which you can use together and which you should not be taking together?
That's an excellent question. All of our formulations have very robust safety profiles behind each of the individual ingredients. Generally, mixing them probably isn't going to be a problem, but I would, put the little caveat on there that, if somebody's struggling to sleep, then it's probably not going to be beneficial to also prescribe them something, recommend something like Focus. So as long as you're kind of utilizing the same kind of general idea of what they want. For instance, sometimes people like to combine sleep and calm, because many people have significant issues with anxiety, and that anxiety is preventing them from getting to sleep. So what we're hearing is a lot of people are using a little bit of calm, an hour or 2 before bed, and then taking the sleep, right before they go to bed, and that seems to help. So they can be combined, and generally that seems to be extremely safe and effective, as long as we're doing it in a way that's rational and not using things that are kind of, adversarial towards one another. Again, every patient's going to be different, and every interaction is going to be different. But for the most part, you should probably be able to rationally use different combinations in a safe.
So thank you again for attending. Is there any last takers? I think we answered everything. So thank you again, all. I really appreciate it. Dr. Barr, you did an amazing job. Thanks for joining, and hope everyone has a great rest of their evening. And if you have any questions, feel free. You have Dr. Barr's email right on the screen. Feel free to send him an email, or send any representative an email, and we'll get those questions answered to you.